All right, welcome to The Explainer. Today, we're diving into a technology that's offering a whole new way to tackle one of the biggest, most persistent challenges in veterinary medicine: how we manage animal pain. Okay, so let's just start with this big question. For any vet out there, this one really gets right to the heart of it, doesn't it? I mean, how do you give your patients real, effective pain relief while trying to avoid all the known risks that come with drugs and the long, tough recovery times of surgery? So, let's start by digging into a problem, a real pain point that pretty much every practice deals with, day in and day out. Yeah, look at this list. You know these names. This isn't just a list, right? This is your Tuesday morning. It's the senior golden retriever with the stiff joints, that performance horse with a tendon that just won't heal, or that post-op case that's got a long road ahead. This is the kind of chronic, nagging pain that's just a constant in veterinary life. And this is where it gets tricky, doesn't it? Your go-to tools, things like NSAIDs, they come with that little voice in the back of your head that worry about GI, liver, and kidney problems down the line. And sure, surgery can be a fix, but it's invasive, and that recovery is tough on the animal and the owner. On top of all that, you've got more and more clients walking through the door actively asking you for safer, non-drug options that you might not even have. So you've got this gap, right, between what your clients are asking for and the traditional tools you have. Well, that gap is exactly where this new technology comes into the picture. So what is this thing, the Vet-Sonotron? Well, put simply, it's a non-invasive electrotherapy device. It's designed from the ground up to let you treat a whole range of pain conditions without reaching for the prescription pad, without sedation, and without scheduling a surgery. It's made to be a direct answer to that clinical headache we were just talking about. Okay, so that all sounds great on paper, but what really, really counts is how it performs in the real world, in a busy clinic. What are the actual results? Well, let's look at a classic tough case, a 10-year-old lab with advanced osteoarthritis. We've all seen this patient. The report here was a noticeable improvement in mobility after just the second treatment. For a condition that's usually about slow, frustrating management, getting that kind of rapid, visible result, well, that's a huge win. But this is the real kicker, the outcome that changes everything. The owner was able to get the dog off daily NSAIDs completely. And that's not just managing symptoms anymore, is it? That's about cutting long-term medication risks and truly, fundamentally improving that animal's quality of life. And it's not just for chronic conditions in our smaller companions. In the high-stakes world of equine sports, where a tendon injury can literally be a career ender, one case study reported a 50% faster recovery time. Think about that for a second. That's a game changer. It means less downtime and a much safer return to competition. So, when you boil it all down, what does this actually mean for the patient? Let's break down the benefits, starting with the one who matters most, the animal. For the animal, the benefits are pretty amazing. We're talking fast pain relief. It's totally non-invasive, so it's stress-free. You don't even need sedation or heavy restraint. But here's the standout point for me: no known side effects. That's what makes it such a compelling option for those long-term management cases, especially in older patients where you're always worried about drug safety. And when you put it side by side with the other common options, you really see where it shines. Yeah, therapeutic lasers are also non-invasive, but you've got those eye safety protocols to worry about. And drugs, well, we know they carry those systemic risks. The Vet-Sonotron seems to hit this perfect sweet spot. It's non-invasive, there are no reported side effects, and it's built for long-term results, not just masking symptoms. So it's great for the patient. We've established that. But a new piece of tech also has to make sense for the practice. So let's talk about what this could mean for your clinic's health, both clinically and financially. All right, let's get right to it. The money. The potential annual revenue we're seeing from the projections is around $84,500. Suddenly, this isn't just a treatment tool. It's a serious financial asset for your practice. So you might be thinking, how on earth do you get to that number? Well, it's actually pretty straightforward. The math breaks down to a modest 5 treatments a day at about $65 a session. Do that, and you're looking at over $1,600 a week. That big annual number, it suddenly feels very, very doable. And the best part is, the workflow to get there isn't complicated at all. A typical plan is just 4 quick visits over 2 weeks. And when I say quick, I mean each session is only like 1 to 4 minutes long. When clients see a positive response that fast, usually after the very first treatment, they stick with it. And that high compliance is exactly what makes the whole model work. Now step back and think about what this does for your day-to-day. You can train your techs to run these sessions, which frees you, the vet, up for diagnostics and surgery. There's no surgical prep time, no anesthesia monitoring. It's literally a one-touch operation. It fits into the flow of the clinic so easily that the data suggests the whole thing pays for itself in just 2 or 3 months. Pretty incredible. So when you put it all together, you really see the whole package. This isn't just a device that's good for one thing. Yes, clinical efficacy is number one, but it's also a tool that drives revenue growth, that gives clients the non-drug options they're already asking for, that makes your whole clinic more efficient, and builds your reputation as a forward-thinking practice. As client expectations keep evolving and that demand for safer, non-invasive treatments just keeps growing, the question really isn't if practices will adopt technologies like this, but when. It represents a clear strategic move into the future of animal care. So I guess that just leaves one final question, the one you see on the screen. Is your practice ready?